Thank you for joining us again on Newsday. Human papillomavirus vaccines, popularly known as HPV vaccine, is a safe and effective way to protect humans against HPV infection and HPV-related cancers, including cervical cancer. To normalize HPV vaccine uptake in Lagos, a town hall meeting with community engagement of leaders, youth advocates, and families was put together by Lagos State Primary Healthcare Board in conjunction with Pathfinder Nigeria, which aims to combat misinformation and build trust through culturally relevant messaging.
We're here in Lagos to have a town hall meeting with community members, from different parts of the local governments, and also representing various community groups and civil society organizations to mainly talk about HPV and HPV vaccine. HPV is the human papilloma virus, and we have a vaccine for it, and HPV is one of the major causes of cervical cancer. What we are doing is to see how we can support the government as Pathfinder International to support the government's agenda of, the goal of eliminating cervical cancer. And we do that in the sense that there's a vaccine, which is the HPV vaccine, that is available, that is been found to be preventing cervical cancer. So because of that, we are working with the states to ensure that at least we get the target group, which is 9-year-old girls, to be able to be vaccinated. And this way, in future, it will really enhance their capacity not to have cervical cancer, which is like a death sentence because it's the second most common cause of death in terms of cancers after breast cancer.
We think that it is good for us to have because our founders, the donor, they were in Nigeria and they have a courtesy visit to Lagos State. So we believe that it is right for them to also hear directly from them. Because often at times they do send their representative here to have this kind of engagement. But now that they themselves are around, so we want them to meet with some of our stakeholders one-on-one so that they can really have that interaction with each other and to actually appreciate them.
Cervical cancer happens in women, and for many communities in Nigeria, they've experienced one family member over the years dying from cervical cancer. Now we have an innovative tool through vaccines, as we have for other vaccine preventable diseases. Like I said earlier on, all of us in growing up, we have like a stamp in our upper hand where we had vaccines for preventing diverse diseases. And so this is a top-notch innovation that would help us, prevent cervical cancer in future.
Our people in the health center, they've already come to us, mobilize us, tell us what is the cervical cancer, the papilloma of this thing. And we've already told our people that this thing, we must take to it. Then we call our people, we make meeting, they bring those nurses to our side. They do some of these things for us. So we like it. Government is trying.